Good evening, good afternoon, good morning. Hello, everyone joining today. I am going live with Rebecca Rich, who is a nurse practitioner at Laurel Fertility Care based in San Francisco, California. And we're going to be talking about summer tips, summer coping tips if you're going through a fertility struggle, having treatment, trying to conceive naturally, first steps, you name it. And also talking about IUI. So we've got some fantastic questions to ask Rebecca today. If you have any more as you're joining, please do ask. The team at Laurel Fertility Care are so lovely and friendly, and it's always such a pleasure to speak to their very experienced team. So hello, welcome everyone. Hope you're doing well today. So we're talking about summer preparation, what you can be doing whilst you're waiting for treatment, in the middle of treatment. Maybe you're going on vacation and you want some advice about what you should or should avoid or you can do. And also talking about IUI, as we've had lots of questions about that. So welcome everyone. I'm going to see if she's here. If you have any questions as we're chatting, please do. Hello, Rebecca. How are you?
Hi, I'm great. Oops, sorry. I'm great, thanks. How are you?
Yes, I'm well, thank you. Nice to see you again. It's been a little while, hasn't
Likewise.
it?
Yeah. It's so great to be back.
So please introduce yourself to those who are joining. I've given you a brief introduction, but yeah, tell everyone who you are, and
Perfect.
then let's talk about IUI and preparation during the summer months.
Perfect. Sounds great. I'm Rebecca. I'm a nurse practitioner at Laurel Fertility Care, which is a boutique fertility clinic in Northern California. Yeah, excited to be here.
Great. So Laurel Fertility Care have just written a brilliant article for us, which I've linked up in our bio. So do check it out after our live, and it gives you all the tips that we're going to be talking about today and expands on that. So the first thing I wanted to ask you was, what advice would you give to your patients, people you see who might be in the throes of fertility treatment or just starting out or thinking about when to have treatment, around how to enjoy summer with fertility always at the back of your mind?
Yeah, it's a really good question. Often when we're going through fertility care, fertility treatment, it's you kind of plan your life around your fertility care instead of fertility care around your life. So it's definitely easier said than done, but I do encourage people to, prioritize relaxation and rest and time with friends and family and, do the best they can to prioritize that and then let the fertility care fit into that more because taking those breaks and taking care of yourself is going to ultimately help your fertility and help your journey if you're giving yourself that self-care.
We've talked about this in the past, haven't we, about taking
Mm-hmm.
breaks? But do you tend to see people kind of taking a break during the summer to go on vacation or have some time off? Or do you think that desire to keep going can be quite strong and people crack on through the summer months as well?
It's definitely case by case. I think, we always really honor patients if they say they've had a trip that they've really been looking forward to. We can try to help, tweak their calendar a little bit or change the medications a little bit so they can go on that trip. So definitely there are a lot of people that just push through, but taking a break can be a natural thing to do no matter where you are at in your fertility journey. So taking a break and choosing summer as that break period definitely makes sense for a lot of patients.
Absolutely. And as you said, sometimes having a break, whether that's like a romantic getaway, whether that's a trip
Mm-hmm.
with family, with friends, it can be quite refreshing, kind
Mm-hmm.
of preoccupy your mind with something else and have a different change of scenery wherever you may be going, even if it's, you know, near where you live, still just to have a different
Sure.
scenery or to even take a day trip somewhere can be quite
Yeah. It definitely can and can gives you, that feeling of autonomy that, you still are in control of your life and can make those decisions even if it feels like you're in the throes of fertility.
yeah. And this must be a question that you get a lot from your patients, but what about having a drink? Alcohol.
Yeah, it's a really good question. We do get that a lot. So there are been several studies and several guidelines, and definitely, not there's not very hard concrete data. Yes, do this, don't do that. But we do recommend with substances, the less you do, the better. The more you can reduce is going to be better just for your health, for egg quality, for sperm quality. The kind of recommended dose would be, or, drink would be, no more than one a day for females, or 7 per week for males. It's a little bit more like 2 per day, or 14 per week is kind of the standard. But even reducing more than that can be beneficial. But I wouldn't, beat yourself up over it. If you went for 2 margaritas on one Thursday, it's okay. It's just everything in moderation is going to be best. And you kind of have to figure out what's best for you in terms of what's going to cause you kind of more anxiety. If it's easier just to say flat out no, it's kind of, you want to, do 1 drink every day or every other day. I kind of have to work with that, but definitely less is better.
Mm-hmm. Do you find that sometimes people do get quite stressed if they've had 2 drinks, for example, and you've said, yeah, try and keep it to 1, for example? Or would you say that actually, sometimes not going overboard, but sometimes letting yourself have a little break so that you're not always being really strict about being gluten-free or whatever it is that you're doing, allows you to relax a little bit and enjoy life whilst going through treatment?
Yeah, definitely. I think it can kind of be either. I don't think people necessarily disclose, everything they're eating or drinking with me. It's kind of what happens behind the scenes. So I just try to kind of validate people's concerns and tell them, we're not watching exactly what you're doing. These are just the recommendations. But I think slip ups or treating yourself here and there have a ton of benefits. And so I really don't want people to be too hard on themselves.
I remember during one of my cycles, the poor nurse, I sent her an email called panicking because I'd had
Oh,
egg for breakfast. And I was just,
oh,
what have I said? Just please, come on, like,
yeah,
fine. So
yeah.
we'll come on to your question in a minute. I think it's quite medically based, but we will get to it.
Perfect.
So the next thing I wanted to talk about, which is all of this is also in this fantastic article. So head to our link in bio afterwards, contact the team, chat to them, read more. It's really good stuff. Toxins, chemicals to avoid whilst you might be having a break. What would your recommendation and thoughts be around that?
Yeah, I mean, similarly, there's just some guidelines that we can kind of go off of. Pesticides have been linked to being harmful. So if you're going to be doing some gardening, definitely wear gloves. Other toxins would be if you're, painting or doing some DIY projects, to also wear gloves and maybe masks. And I would just encourage people to, read labels and try to understand what products they're using for their house or in their yard or what they're eating. Because that can be kind of beneficial to let yourself be super clean, but not something to really nitpick over too much, but just kind of, if it says it's safe for humans, it's safe for humans. But if it has some sort of warning, or you need to be wearing protective gear or certain outfits or eyeglasses, that might be something you would want to avoid while you're doing fertility treatment, just in case something gets in your eye or something like that.
Yeah, absolutely. I think that's also something that I've seen come up before, where it's kind of like the worry about toxins you can find them everywhere, can't you? So from cooking
Yeah,
pans, utensils, you name it.
yeah,
Like,
yeah,
where do you draw the line?
yeah. So that's definitely, it has to kind of be your personal choice and case by case. But I think, when you cross over to becoming too anxious about everything, that's going to, be a little bit harmful. So,
Yeah.
try to kind of choose which areas, maybe it's food and you want to do organic and non-GMO, or maybe it's the chemicals that you're buying and you want to get healthy shampoo. So, kind of pick the lanes. And I think, try to be perfect in every category will be pretty impossible.
Mm-hmm. Someone has just been asking a question. Do you mind if I ask you a couple of questions?
Sure, yeah.
Quite on the topic today, but as I mentioned, if you'd like to have a consult with specialists at Laurel Fertility Care, then the link is in the bio, so please do, because that's personalized care. But this is a sort of question around, I think, removing polyps, the recovery time and the procedure. How long after getting the polyps removed can you do IUI?
That is probably going to be best for your specific doctor that you're working with. Kind of depends on exactly what type of surgery or procedure you're doing, and how many polyps, and if there's anything else that's going to be removed. I mean, in general, the recovery period is not that long, and normally people can go into a cycle pretty soon after having a procedure like that. But that's one I would really, ask to your own doctor.
Yeah, Dr. Schmeichel would be a good one to ask, and the link is in the bio if you want.
Yeah, and it'll be case by case. Yeah.
Someone has just said, I totally agree. After trying to conceive for 7 years and doing IVF for 4 years, having back-to-back retrievals, I'm taking a break for 3 months where we will be going on a cruise for her husband's 40th, which sounds amazing.
Nice. That sounds amazing.
Yeah, I'll definitely be having a drink or two to celebrate. We will then do a frozen transfer in September. It will be our third transfer. And I think that's lovely because, these are a 40th birthday, whatever these milestones are. It's, you have to celebrate these things. So I'm wishing you all the best with enjoying the celebrations and also your third transfer in September. And then what else have we got? If anyone else has any more questions, feel free to ask as we're chatting. Exercise. What do people do or don't do whilst they're mid-cycle, preparing for a cycle, over the summer, in the heat? What are your thoughts?
Yeah, so definitely across the board, we recommend exercise. I mean, moderate exercise, hundreds of studies show that it's helpful for every aspect of your health, but specifically fertility care, because it does help regulate your hormones and get your body kind of a little bit more on track and ready to be going through treatments. And so moderate exercise. So we don't want you, unless you're already a marathon runner, we don't want you to take up something completely new and really intense, like running 15 miles a day. We want, to kind of stick with a routine that's more moderate. So, walking is really great, walking up hills and stairs to get some cardio, biking, swimming, choose what fits for you and your lifestyle and continue whatever you've been doing. We just don't, recommend changing to something really intense while you're in the middle of treatment.
Yeah. And swimming after a transfer, do you tell people to avoid that?
There's kind of different guidelines, and that's, different OBGYNs have different opinions on that. But for the most part, we kind of wait till after the first trimester, but that could be different depending on your clinic, depending on your situation, if there's bleeding or some other things.
Okay. And I presume the weather is hot with you right now. I don't know if you've read in the news, but in the UK, we've been having
yes.
ever had.
Yeah.
And obviously we're not set up with things like aircon, and if you're in a city like London or wherever you are, claustrophobic. There's no like, pools or beaches or whatever. The heats and effects on fertility. What are your thoughts on that? Should people try being too hot?
There's kind of a little bit more studies done on sperm, right? We don't recommend too many hot tubs or really tight compression shorts or leggings for super long time, because that can affect sperm quality a little bit. And extreme, heat, if you were on the beach in 110 degrees for 10 hours, we wouldn't recommend that. And also hot tubs, we wouldn't recommend doing that after a transfer. But other than that, I would say the main concern is dehydration, which is, concern in general for your health. And so making sure that you're really hydrated, especially when you're taking new medications, fertility hormones, you want to make sure that your body is not getting depleted. Water is super important. And then if, during certain parts of your transfer or cycle, a physician or might recommend electrolytes. So if they do recommend that, I would highly suggest that Gatorade and other kind of drinks that have electrolytes to kind of also prevent that dehydration.
Okay, that's good to know. How would you know you are dehydrated?
It's a good question. Not having as much urine output or really dark concentrated urine, dryness around the mouth and thirst. Yeah.
Okay, that's good to know. And how can people prepare for IUI? Because we talk about IVF a lot, but many people who are trying IUI. What are your recommendations for that procedure?
Yeah, I think, they are pretty similar in terms of, always the lifestyle stuff, healthy diet, moderate exercise, sleep, like when you can. And for IUIs, I would say the thing to kind of, mentally prepare for a little bit is that your calendar definitely changes. So they might say, oh, like, potentially trigger on this day, and just know that that day can really change forward or backwards. I think a lot of times patients get really, tripped up on that. Like, I thought it was going to be on Wednesday and then the IUI on Friday, but those are actually just tentative dates because it really depends on how fast your follicle or follicles are growing. And so I think just knowing that can be really helpful for patients. And then, yeah.
To prepare in the same way in terms of not drinking too much and things like that if they're having IUI?
Yeah, we do recommend that. There's not as much kind of concrete data on how it affects things, but in general, having those lifestyle modifications just help your fertility in general. And so, why not kind of try that out and see if it's going to help a little bit more.
Absolutely. Someone's just said, is it pedalite be avoided to help dehydration in the summer, or is it okay to consume?
Pedialyte?
Is that what it is?
Probably. Yeah, I would kind of want to know more the reasons behind taking, Pedialyte and everything. So I think that's kind of more a specific question for your own specific provider.
Yeah, thank you. That makes sense.
Mm.
Thoughts on diet tips during the summer?
Yeah, I think, it's often in studies kind of more that Mediterranean diet. So limited red meat, limited processed food, limited sugars, focusing on fruits, vegetables, lean protein like chicken and fish. So there's nothing, too specific about summer, I would say. Just eat that arrangement. And, if you're going to have dessert and all that stuff, it's definitely okay. We just want you to kind of be mindful and do it in moderation.
That makes sense. And do you see patients, doing keto diets and all sorts of different things, or going gluten-free?
Yeah, we have lots of patients that do experiment with different diets. It's kind of similar to the exercise. So if you're doing a diet and that stuff to prepare your body, that's totally great. We just don't want you to, be in the middle of a treatment and completely change your diet, because we don't know how that's going to affect, your body and your physical body. And so, and even your mental state. And so, try to kind of work on those lifestyle stuff, or if you're going to do keto, check in with your doctor first about that and figure out the right timing, because some diets can be really intense on the body.
Okay. And someone just mentioned back here about BMI. The BMI for IVF?
Every clinic is actually a little bit different in terms of if they have a BMI cutoff or not. So that's also case by case.
Okay. And I was going to ask, well, I was just going to say that you touched on, I think it's a really important point, and with the comments we've had today and people telling us about their plans, just like a recommendation also from my own experience, to spend time with people that make you feel good. Can be a really challenging time. So vacation, or you're meeting up with people, especially now that sort of things have moved on from COVID, then just surround yourself by people who either, if they know, are kind of understand and really, get it. If you're not drinking, for example, many questions, or they know and they're supportive, just so that you feel like you are being supported by a community, versus it being even more challenging to sort of keep up that healthy work.
Yeah, I definitely agree with that. Surround yourself with the right people is really important. I also think, it's easier to say no than people think. Sometimes people think, oh, if I turn down a margarita, they're going to think I'm so weird, or they're going to think something's going on, and I have all these follow-up questions. But a lot of times, you pass up a drink, no one's really going to notice. Or you just say, I want water today, or I'm feeling thirsty and dehydrated, and that margarita is going to, make things a little bit worse. So I do encourage people to kind of, not shy away from parties, just because of, embarrassment or something like that. Because it might actually not be as hard as it you would think to kind of turn down the red meat or the cupcake or that extra glass of wine.
Actually, on the alcohol front, what I used to do is so that there was a reason to not be drinking.
That's great. That's a really good tip. I think, yeah, a lot of people could kind of try to find what fits them best.
Absolutely. And you're right, like it might feel like a big thing to be turning down something, but people are so kind of wrapped up in what they're doing, they probably won't.
Yeah. Yeah, exactly.
Any thoughts on this topic or IUI or the upcoming months?
Yeah, I think, summer is a fun time. We look forward to it all year round. So I really, encourage people to let themselves have the summer that they want, that they've been looking forward to, and talk to your provider about how you can, plan your schedule and calendar to kind of fit the things that you want to do in, and use that time to rest and relax and kind of rejuvenate yourself.
Hmm. Absolutely. Yeah, that sounds great. Well, I'm going to be coming over to California in October, so I'm really excited
Nice.
about, meeting all the team. And yeah, if anyone has any questions for the team, they are so lovely. Always, always happy to help. So DM us, you can DM them or
Hmm.
drop us an email or go to our link in bio to find out more. So
Perfect.
the only annoying thing is if you're not drinking, people assume you're pregnant, which then can be upsetting. That is so true. That is so,
Yeah.
and if you feel like that, perhaps thinking that, you can always, if you feel comfortable, say, this is a challenging time. I'm not pregnant, but would appreciate if you could just sort of basically let me get on with it.
Yeah.
Yeah, I'd be.
Yeah, that's hard because that is definitely where people's mind go. But coming up with a different excuse is just as good.
Hmm. Absolutely, absolutely. Well, thank you to everyone for joining, and thank you so much for your time, Rebecca. It was lovely to
Of
chat.
course. Happy to be here. Be in touch.
Bye. Bye.
Bye.